Hello, Julian.
Hello, Mike.
Hey, what are we going to talk about on Veterinary Ramblings tonight?
Well, that's a good question. I thought maybe we should have been
Whoa. Hang on a minute. It's not about you guys tonight.
Yeah, this evening we're going to be doing Veterinary Nursing Takeover of Veterinary Ramblings. So welcome to the Veterinary Nursing Awareness Month special of Veterinary Ramblings. So be ready.
Hi, I'm Mike Brampton.
And my name is Julian Hoad.
Welcome to Veterinary Ramblings.
So I'd like to start by introducing our panelists. So I've had the pleasure of working with Mike Brampton for well over a few decades now, probably longer than we'd like to consider. And I think Mike has had a huge positive impact on veterinary nursing through his passion for anaesthesia, giving nurses a greater understanding and therefore more confidence and therefore more safety and better animal welfare through just explaining things in terms that even people like me can understand. I think that's super important. I think that the impact that both of our panelists have had this evening has had a real positive impact on veterinary nursing. I know that they've both had a positive impact on my career, but I think also they've had a kind of overarching benefits to the greater good of veterinary nursing. So Mike, could you just sum up what you've done and when? Maybe protect the innocent by not putting too many years in, because keep it lighthearted.
I'm very flattered, and thank you very much for saying that, Matt. I'm quite humbled by what you're saying there. I would say that anybody had the same opportunities as I have had, gifted to me, would have made the same moves. And it's just happened that I happened to be in the right place at the right time. And I think my main interest in veterinary medicine and anaesthesia started in about 1984 with the first recorded use of a brand new device called a pulse oximeter.
Wow.
And that came about thanks to a fabulous dentist called Peter Cortez, who he was one of the first private dentists in human medicine. And we were both sitting on a panel advising on anaesthesia safety in dentistry, which was led by Professor Boswillow from Guy's and Tommy's, who I'd worked with on the introduction of propofol as an anaesthetic agent when it changed its license from a sedative agent. So I'd worked with the prof on that about 5 years before, and so was invited to be part of this safety in dentistry thing. We were sitting at a dinner and I got a nudge with the elbow, and this chap called Peter Cortez said, "Would this device that you've just introduced us to work on my patients?" And of course I was thinking human anaesthesia, human dentistry. Yeah, I should think so. He said, "Brilliant, can I play with one?" I said, "Yeah, okay, no problem at all." He said, "Fabulous. Regent's Park next Tuesday." Right. "Can you be there at about 8 o'clock? Yeah. Bring the pulse ox. I'll introduce you to the patient." And the patient was Arthur, the lion, who around the time of Guy, when Guy was the signature animal of London Zoo, came Arthur, the male lion. And what Peter was doing was knocking him out and doing some basic dental work on him, which is fairly consistent in zoo medicine, as Julian would attest to, because he's worked as a zoo vet, as have you indeed, Matt. So have you done wild animal stuff, Joe?
No, just rabbits.
Just rabbits. That's
Well,
pretty
they're
exotic.
silly.
But just the one trick pony.
Yeah, but they've got huge teeth.
It's all about the
nasty,
teeth.
sharpy, pointy teeth.
Huge teeth.
Oh.
So that was the first occasion. And of course, we rocked up with this pulse oximeter, and the lion didn't seem to have fingers or toes that we could get data off. And Peter had got this big headlight on that he was operating in the mouth on, so he couldn't get anywhere around the mouth. So what we did was we put it on his penis. And that's where, if anybody's heard...
The lions?
Lions, yeah.
Yeah,
just
not Peter's, not Peter's penis, yeah. Because
Right,
he's got
good.
fingers and toes. We could have put that elsewhere on him. But
Life lesson right there, isn't there? If you don't know
Yeah.
where to put your pulse ox, put it on the penis.
Yeah, absolutely. There we go. So that's where one of my golden rules for pulse oximetry started, which was a well-perfused capillary bed that's accessible. So that was it. It sort of all went from there and went through the pulse oximetry, Blood pressure was the next big thing for me. And again, that was a transfer from human medicine, where I just invented a Doppler to listen to aortic aneurysms to avoid entrainment of air through open brain surgery.
Don't you love that throwaway line where I just invented?
Yeah, I
Totally.
spotted that one as well. Yeah, just as you do,
Actually on a Sunday afternoon.
I'm sure if other people had the opportunities that I had, then they would have done that.
I'm
I'd
pretty
say to
sure
the
I
pasta
couldn't
dish
invent.
once.
And that,
yeah.
well, that turned into the cat Doppler, which
Oh,
is
love
now
cat Doppler.
used by all sorts of people in anaesthesia, but also on unconscious cats for blood pressure. And then hot on the trail of that, of course, was capnography. And that's introduced me to a whole new world. And I've just enjoyed my time sharing and working with some amazing people, yourselves included.
It's interesting.
All of
that you
those things.
mentioned-
Oh, sorry, Matt.
No, sorry, I was going to say it's interesting you mentioned Peter Cortez because I've worked with him, and he's incredibly supportive of veterinary nurses, and I learned a huge amount from him about dentistry, including some things that vets and nurses had lied to me about for many years about the dentistry of the dentition of certain species. So really incredibly knowledgeable guy. I mean,
Fabulous guy.
Fantastic. So
Fabulous guy.
I think, and also I just want to pick you up on one thing is Amy Martin, who's been a great mentor to me over the years, says that you mustn't say things like you've been lucky or you've just had opportunities. She tells me off for this and sometimes threatens physical violence because she says you kind of, you get involved in these things because you're passionate, because you care and you see a niche and you want to make things better. Okay. So don't take that away. You've done a huge amount. As I say, I've learned loads from you over the years in various things, and you're always up for a nice heated debate about random species and random situations that I find myself in. So no, I'm very grateful.
Thank you very much, Matt.
And I think to echo Matt's sentiments, absolutely don't play down what you have invented and achieved, because ultimately what you've done is you have revolutionized parts of the welfare journey of many, many, many animals and humans. So as a nurse, being empowered to look after your patient in a more safer way, that's brilliant, because we feel more confident being able to use these tools that have come from your brain and come into life. It's not just some random drawing, your 4-year-old kid has done. This is an actual thing that has changed and saved lives. I mean, it's pretty incredible.
Thank you.
I've completely echoed that. I'm constantly in awe of what Mike has achieved and how self-deprecating he is.
And I think that's the thing. And that's
I'll never tell him because it'll go to his head. But
yeah, let's not ever tell him. I mean,
don't tell him, will you? Don't tell him. Don't tell him.
No, don't tell him. He won't notice.
But I'm feeling very humble, ladies and gentlemen. Thank you.
Oh, we love you, Mike. And I think it's something that is worth talking about in its own niche before we get to Julian's introduction, because it's a typical veterinary trait, I think, regardless of which of the jobs you've chosen, from, receptionist, assistant, nurse, vet, clinical director, practice owner, whatever. I think we have so much imposter syndrome and we're so self-deprecating about what we have achieved, because it's icky to talk about. Actually, sometimes we have to accept we are a role model, or we are an industry leader, or we are a thought provoker. And it's, that's quite amazing to think that, and humbling, very humbling, but to think that you've touched people's lives. And except British people are rubbish at accepting a compliment. If you say that's a nice dress, instantly we don't go, thank you very much. Instantly we'll say, oh, it was a bargain. I got it off of XY seller that others are available.
If anyone says that's a nice dress to me, then I instantly think, oh gosh, I hope I'm not recognised.
Which party I'm at.
Yeah.
Which supermarket?
Absolutely. Brilliant. So moving on then, Julian, obviously we echo the same thoughts that Matt has said about yourself. You've been quite a trailblazer throughout different parts of your career. And certainly in the time that I've known you, you have been exceptionally pro nurses and whole veterinary teams as well. So all of the support staff. And I've spoken to plenty of nurses that feel the same way. And given us the opportunity to use our voice in different places. And I think that's a very powerful thing. So would you like to just have us a quick chat about your career?
Gosh, feeling very humbled as Mike was. We'll get to that in a minute. But my career, well, I nearly didn't have one. So I mucked up some of my A-levels, didn't get the 3 A's required, and was told at the time that no one was accepting vet students on retakes. So I did another degree and did 3 years of a biology degree. And during that time was in constant contact with Liverpool, who said, yeah, if you get a 2-1 or above, then we'll give you a place. So I got a 2-1 or above, and they said, no, sorry, we've changed our application process, and we're not accepting graduates anymore. So I gave up. And it sounds awful. I gave up and became, well, that's not giving up, is it? That's, as you said,
you stepped sideways.
Taking an opportunity. I didn't give up. I thought, what else can I do that I really enjoy? And I'd done a degree in microbiology and biochemistry. This was at the time, it was 1985. It was a time that HIV was coming to the forefront and everyone was investing in research in HIV. So I thought, well, that's the place to go to do some really fun, interesting research that hopefully is going to be of some help to people. So I did 3 years of HIV research. And then I thought, well, just about to embark on a PhD, but I really still wanted to be a vet. So I thought, well, I'll have one more go and get it out of my system. Wasn't expecting to get in at all, which was great because it meant there was no pressure on me during the interviews. Yeah. I actually enjoyed the interviews, gave the answers that I wanted to give rather than the ones that I thought they wanted to hear. And lo and behold, got in. I'm going to skip back. So that was at the tender age of 25. My love for the veterinary profession and my realization of what nurses do started when I was 11. And I started, well, seeing practice. It wasn't really seeing practice. It was going and hanging around and making a nuisance of myself at a local practice. And the very first person I met was a lovely veterinary nurse called Josie Kilner, who now is a practice manager at the referral centre. I'm godfather to her daughter, where we still remain very close. And she was brilliant because not only did she actually take me under her wing and tell me interesting and useful things like what's a cat's temperature and why we do it in the rectum, not the mouth, and useful things like that, but she also let me scrub in. Right. And it was actually her decision to do that at the time. It was, oh, go on, Nick, let him scrub in because he's very interested. I wasn't 11 at that time, I was a bit older. But I began to see that actually, even at that stage, and this was, gosh, in the 70s, there was still in my mind a knowledge that it's not the vet on their own. There is a team at work here. And without that team, nothing happens. So it was the nurses sharpening the needles, cleaning them out in Dettol before injecting the cow with. Yes, that really happened. And sterilizing the needles. And so before we sterilize them in a big drum, we run the needles against the back of our thumbnail because then you could see if they were sharp or blunt. And then, they'd all go in this drum. Number of needle stick injuries I got daily was absolutely incredible. I'd go home about 2% hematocrit lighter each session. But I knew that, that the nurses were getting things ready, not only equipment and not only cages, but getting the animals ready. And we didn't have proper pain relief in those days. The analgesia was a concept yet to be invented. There were no non-steroidals. But the nurses would give real tender, loving care to the patients. And they'd still use cold. So I'd go and get the pack of frozen peas from the freezer, and the nurse would tell me how to hold that against the limb, and that would ease the pain, and how stroking them would get them to eat. And there was the science side of things and the mechanics side of things, and there was this love and care side of things, together with actually, practically, if we don't get these kits ready, nothing happens. If we don't draw these drugs up, nothing happens. Because invariably, the vet would stand there with his hands up, waiting,
like looking at the watch.
Come on, and he had a strict rotation, so it would be orthopedic first, and the nurses would apply the drapes. He'd do the orthopedic op, and then stand up, and they'd take that dog away, and then they'd put the bitch spay in because that was the next sterile op. He wouldn't wash in between, so he'd be covered in blood, but he'd dip his hands in, do the bitch spay, hands up. They wheel that away and then get the cat spay. Here you go, cat spay, hands up, and then the cat castrate, because that was, as he told me very proudly, the least sterile of any op you ever need to do.
Nobody tell the cats, yeah?
But nobody told the cats. No idea. Obviously, everything got a good old shake of Penn Britain, powdered penicillin in those days. And it never struck me that he would apply this Penn Britain and he'd have a bottle on the side. Now, the bottle wasn't sterile, but because it contained antibiotics,
it's okay.
The implication wasn't good. So he'd do this orthopedic op. He'd pick up this bottle of Penn Britain and tip a bit in, and he'd eyeball it because he knew he had 3 other ops to go. So he knew exactly how much he needed. He'd put it down, hands up. And so already he's broken aseptic technique. Anyway, so that was 11 years onwards. And actually, I worked there for 4 years after qualifying. Really lovely practice. The original vet had long since shuffled off the mortal coil, but the new vet was great. And again, had a tremendous reliance on nurses, or that's a silly thing to say. Every vet has reliance on nurses, whether they admit it or not. He had a real understanding that actually for the team to work, he would get the best nurses in to do it. So I did my degree, I had a job, and another job. And during all that, because I was lucky enough, and I'm going to use the term lucky here, Matt.
You are going to get a spanking for that.
So there's luck and there's judgment. Luck is getting the opportunities. Judgment is choosing to use them, isn't it?
Yeah, absolutely. What you do with that opportunity. I think lots of us have those sliding doors moments, don't we? And the decision that we make takes us on very different journeys.
Yeah, and I've very much been someone who says, yes, please, rather than, oh, I don't know. Which has got me into loads of scrapes. because I did this microbiology degree and because I'd done virus research, I was lucky enough in my first year of college to find that the virology lecture was on long-term sick leave. And they knew that I had a virology background. So they asked me if I could lecture my year on virology, which I was more than happy to do. And I taught them some biochemistry as well. I had to sit in the exam still, which I helped to write. So fortunately, I passed.
Wow.
But it gave me not only a bit of pocket money, it gave me a grounding in lecturing. And that's something that I've always been keen on. And I was honoured, quite literally honoured, 17 years ago to have been given an honorary membership of the BVNA for helping with the scientific committee, the Congress Programme Committee. And to this day, that has been my most treasured accolade. And I will, I'm not going to pretend I'm a vet nurse because I couldn't do the stuff you do, really not. But I'm an honorary member of the Veterinary Nursing Association, and that is a true honour. But during that time, I was able to lecture at BVNA and around various veterinary practices and then to nurses and to vets. And I worked for a while with, do you remember Margaret Moore, who ran Cerberus breeding? So I lectured for her for a while, which was a tremendous adventure. Her husband, Vic, was a systems analyst. And he'd go through all my lectures and say, okay, this, because it was all on acetate sheets at this time. He said, okay, we're going to cut this acetate sheet off and stick it there because that goes better there. And he'd rearrange everything and it would work much better.
Until the sticky tape falls apart and then your lecture just goes into piles on the floor.
Absolutely. Absolutely. So that was it. I then bought a practice, or bought into a practice, which I subsequently sold, now occasionally locum for. But the bulk of my day is working for the BSAVA. I'm at the moment president of BSAVA, having volunteered there. There's been a huge underrunning current of my working career is the BSAVA and the work they do, both in terms of CPD and in terms of other forms of educating the veterinary profession and hopefully the owners too. So that's me in a nutshell.
Absolutely. And we only took 6 hours. I mean, who knew?
Yeah.
It's interesting that now Joe and I are also involved in the BSAVA, because I think it is amazingly supportive for nurses now. And I'm on a volunteer on the Congress committee, and I'm really enjoying it. I mean, I'm learning huge amounts of stuff as we go through it all, and it feels really nice to be able to support them. And so I think it's great. And
you're doing a tremendous job, Matt, and it's great having real nursing involvement in the BSAVA now, both from you and also from Joe, who by the time this podcast goes out, it'll be general knowledge that Joe will be part of the BSAVA board come June.
amazing.
The first
Congratulations, Joe.
ever RVN to do so. And what a tremendous achievement for you, Joe. Really, you've deserved it. You absolutely deserve it. You'll make the board flourish in ways that we have yet to find out. So thank you very much.
Thank you. Yeah, I'm so excited for it. I'm excited for myself and my own personal growth, but just that milestone of getting a nurse on the board. I mean, BSAVA have always been so supportive of nurses, and they've always been inclusive of nurses in some way or another. But I don't think they've ever been as inclusive as they are now. There have been challenges in the past, but that's with the whole of the industry. It was difficult to get a seat at the table, whether that be just coming to a CPD or getting onto councils and things like that. So it's a tremendous step forward. And I think it just really shows the commitment that the BSAVA have to the whole team and the team approach, and that nurses' opinions are valued. And I think we do have, like you say, you couldn't be a nurse. I couldn't be a vet. I had the grades to go either way, and I chose, actually, I don't want to dip around in wobbly bits. I want to be dealing with, picking up the poop and the vomit and taking them out and sitting and chatting to the ones that want chatting to, and stroking those cats until they feel better. And that was where I wanted to spend my time in the profession. And I think allowing us to play to our strengths, which again has happened more so, I think, in the last 10, 15 years than maybe previously, to have a bit more autonomy with regards to what we would like to do and where we can flourish as nurses and vets as well, having vets that don't have to do surgery, that don't have to do consults, allowing that flexibility to work with humans in the best way that we can. I think BSAVA really kind of spearhead that and really progressive on that side of thing, really. So yes, so onward and upwards for the nurses in the BSAVA, as my hashtag is be more BSAVA.
Absolutely. BSAVA has always had this opinion that, and I'm going to diss some of the other CBD providers, that there's been a pro rata, well, who earns the most for the practice? And that's a nonsense.
Yeah.
So it's so interesting because it comes up a lot now, and one of the really good proactive sessions we had at the recent BSAVA Congress was all around Schedule 3, and it was interesting that there were some people saying that if a nurse is carrying out a procedure, it should be charged out at less, and we were kind of discussing how that doesn't really make any sense. I mean, it's really not forward facing, as you say. We need to keep pushing these things forward, but
absolutely.
I think
so back to the first practice I worked at, they charged a higher consult fee than the assistants.
Yes, I remember those times.
Yeah.
I had that one of my first practices of kind of seeing practice, like you say, loitering around with a broom, trying to make tea and make yourself useful to try and get a foot in the door. And also the head vet licked the suture mid to lick the catgut as well to put it through the needle. But there we digress.
Yeah, very different times. When you were talking about the kits, it made me remember that when I was first in my first practice, which actually I think Mike and I met at that, which was the Park Veterinary Centre in Watford, which was Johnson and Daniels at the time. And I can remember in my first period of time there, one of those vets that was working his way through the list like an absolute, legend, going through procedures one after another. he demanded another kit and stared at me. And I went out into what was the sterilizing room and didn't really know what I was doing. So instead of opening the autoclave and the little sterilizing thing and taking the kits out, I wasn't sure that was safe. So I just unplugged the whole thing and carried the whole thing through to the operating theatre. And I can remember thinking, not sure this is right, 'cause it's quite heavy, but I remember thinking that it was probably the best solution at the time. And the look on his face was a picture as I walked through with a 40-kilo sterilizing unit, not really knowing what I was doing. But yeah, I learned afterwards how to deal with it. So, okay, we're going to start with our first question, because your introductions have covered so much and it's been fascinating listening. I mean, and Julian's ability to lecture, I think you explain things so well in your lectures, and you're very good at being incredibly inclusive. So, you know, I think you undersell yourself then. I think your lecturing style is incredibly good, because I think you could cater.
I'm always envious of Mike's lecturing style.
Yeah, I think you both have a similar thing as regards kind of how you just make things accessible. And that's what it's all about. I think there's been too much, especially in the zoo, wildlife and exotic stuff over the years, there's been too much of an emphasis of, oh, this is what I do because I'm amazing, but you can't do it. Whereas I think there's much more of a turning in that tide now that we try and include everybody and get everybody involved in what they want to do. So, yeah, I think that's really good. So, first question, I'm going to put this to
So
Mike.
that was great. Thanks very much, dude, for that, Matt. Go.
And that's the end of Veterinary Ramblings.
Don't get away that easily, yeah. It says that, you know, you're going to have to work for your wages this evening.
It gets so much more tricky.
Yeah. So, Mike, during your time of working alongside the veterinary and within the veterinary professions in various aspects, what have you seen change about veterinary nurses? So, how have you seen us kind of progress? Do you think you've seen a noticeable? Obviously, there's been a huge swell in numbers. We're nearly 25,000 registered veterinary nurses now. So, what have you seen? Have you seen more? What have been your experiences?
I think for me, over the time, it's over 30 odd years. Veterinary nurses have become infinitely more professional, far more knowledgeable, and the range of tasks and skills they have, and this is because vet nurses and progressive vet nurses have almost demanded this. The qualifications and the training have improved immeasurably. The exams, it's chalk and cheese. I think the profession has come so far. There are still a few people who sort of attempt to hold the veterinary nurse profession back in that I'm a real vet and I'm the vet. But more and more, I think the profession as a whole is becoming more receptive to the professional role of veterinary nurses. And the knowledge base that has developed within the profession is phenomenal. You know, it's
really interesting, because I think we struggle a little bit sometimes with there's still a few nervous vets that I think are just completely outdated now, where they're worried about us becoming kind of mini vets.
Yeah.
And
here comes the Rendle quote. I love this one.
Quote,
come on, Matt, drop it.
My quote is always, I never wanted to be a mini vet. I just wanted to be an enormous veterinary nurse. And I think I've managed that in some shape or form or another. I think that the professions complement each other incredibly well. When we work together, the synergy and the positivity that creates is incredible. And having worked in plenty of countries where they don't have vet nurses, I mean, they're missing a trick, because I think it has an amazing amount of positivity for not only for animal welfare, but for the client journey, the animal journey, everybody's kind of happiness within that environment, reducing stress for the vets. And I think that's really important. And as you say, the level of educational knowledge now is on the up all the time. I know from when I did my qualification, it was pretty basic and I still failed one of them, but let's not talk about that. But I did pass it in the end. You'll be pleased to hear. But when I work with students now, I've been very lucky to have some students recently, and their knowledge is amazing. They've learned so much more than I did. So I think
there's a lot more respect for the role, I think, as well, and that's been brought about because of veterinary nurses' professionalism and the skills and knowledge that are being brought to the table, and that's that's well-earned respect.
Yeah, I think that's really interesting. So, and I think if I can go over to Julian, the same question. So how have you seen it working, clinically in practice and within your lecturing journey, what have you noticed?
There's always been a hunger for knowledge from nurses. And that's, when I say hunger for knowledge, there's two ways that's demonstrated. There's a knowledge for knowledge's sake, and there's a knowledge for making your working life better. And invariably, it's the latter with nurses. It's, I want to learn this because I want my day to be better, because the patients are getting a better level of care. There's not, I want to show off. I want to be able to recite all parts of the cytokine pathway. There's, okay, what can I practically do to give this pet and the owner a better journey through their illness or through their health? And that's always been there. As Mike said, the level has increased. So there's been a sort of a tenfold factor of the knowledge base among nurses. Whereas when I first qualified, the nurses would monitor the anaesthetic using the stethoscope and counting rests. And we had a little machine that went beep occasionally when an animal exhaled. I always said expired. Exhaled.
I probably still went beep then.
Yeah. But now nurses are properly interrogating capnographs much more expertly than the majority of vets. You know, without fail, 90% of good capnography interpretation is done by nurses, I would say.
Yeah.
And able to then say, well, okay, sure, this is hyperventilating, but also, okay, do we think we need to get an ECG on this dog? Because I think there's something going on with the heart rate here. Just looking at the capnograph. Well, look at the ECG. Well, yeah, okay, I looked at the ECG. That's not particularly abnormal, but let's do an echo after this. Yeah. Oh gosh, yes, you're right. There's hypertrophic cardiomyopathy here. And you pick that one. Capnography? How? And then I get a lecture for the nurses. That's just one example of many, where we asked the nurses initially, 30 odd years ago, to draw up some Vesagesic or Temgesic, I think it was. We didn't even have Rosic in those days. So the buprenorphine was the human one. These days, we're looking at opioids. Okay, so let's have fentanyl or CRI. And what else do we want with that? So, well, should we have ketamine, do you think? Oh, Julian, I don't think ketamine for this, do you? I mean, there's unlikely really to be any need for an NDMA antagonist, because I don't think what you're doing is neuropathic. Oh, yeah, you're right. Just testing. Oh, yeah, that's right.
Well, that's it, and that that really highlights the team approach. And it's not about I'm better than you or I know more than you. It's that team approach, and that's where nurses have been. Certainly through my clinical journey, I'm there. I got so much pleasure from supporting the vets when they're tearing their hair out, and the last thing they want to do is scale the damn cat's teeth,
Yeah.
And as an ex-human dental nurse, I've got this, as well as my veterinary training on top. You go and whether that's 5 minutes, whether that's writing something up, whether that's seeing another patient, we've got this. Good series of x-rays. There's very few vets that really enjoy doing that on their ops days. That's fine. Us nursing team, we've got this. And I think that by us having to shout, and we have had to shout a lot about what we can do and stamp for our positions and say, we really do have this. And that's what's changed, I think, over the last few years, is we've got a lot more shouty and we've been listened to as well. And I think, again, that goes back to very supportive vets who understand and have experienced that lovely journey of having supportive teams and saying, yeah, we can do this better. There is another way, and just questioning and saying, yeah, what is this other way? What can that look like?
Yeah, I'd love to see some sort of statistic for complaints. It's my personal opinion that practices that have teams that work really well together with vets and nurses receive fewer complaints than the practices where vets are siloed and nurses are siloed. And we work with evidence-based these days, don't we? It seems fairly obvious, but I'd like to see some stats for it. Absolutely certain. Nurses are so much better at talking to clients about many things. In fact, a lot of clients will come out of a consulting room and say, okay, can I chat to a nurse because I didn't really understand what was going on?
Yeah, so that's
We see
such
that
a
all the
common
time.
thing.
Mm.
And I don't think that onus is completely on the veterinary professional either. I think we get like professor blindness, don't we? As a human that's going to a specialist in their area, whether that be a doctor, a chiropodist, a vet, we can get a bit blinded by, yes, sir, no, sir, thank you, sir, thank you for your time, sir. And as much as we see the other side of clients as well, I think there's still a lot of clients that very much value our opinions and then throw in a whole bunch of emotions because we're dealing with their fluffiness that they're worried about. And we've maybe given them good news, bad news. Either way, they've been separated from their cat all day. Oh my God, Fluffkins is back. Not listening to a bar of it. And it's only when they get out to reception, they go, oh, yeah, what did they say? And nurses have always been perceived to have that little bit extra time to bob out and have that chat. And I think sometimes we speak, and certainly the way I lecture is in plain English rather than, so I'll talk about wobbly bits rather than, the fusus coli, if that's not my specific point. I think that's the thing. It's communication skills, isn't it? And a lot of us go into vet med because we don't want to deal with humans, and then we end up dealing with humans.
I know, absolutely. It's wrong to say we're vets and nurses because we like animals alone. We're vets and nurses because we like the human-animal bond.
Yeah, absolutely. Excellent. Well, I think that leads us quite nicely on to another question.
We have another one. We've answered one.
I know. So this kind of, I'm going to start with Mike on this one because, Julian, you've already given us a lovely example of this. And
Sourdough. Yeah, sourdough. But I don't eat that much bread.
With or without smashed avo on there? What are we doing with that?
Okay.
Okay, smashed avo and a poached egg, okay.
Oh, okay. Increase on that? No? Okay.
No. All right, so next question.
So what I want to ask you is a lasting memory or an impact, a nurse that's had an impact on your career. Have you got anyone that springs to mind or any intervention, interaction that springs to mind just to really put you on the spot? And obviously, Matt and I are the top of your tree there. We're the first ones you're going to think, of course.
Well, yeah, absolutely. I remember a young chap who was big into frogs.
First
time I met him. Still is.
Mountain chicken frogs, or were they different ones at that stage?
No idea. I've forgotten that. But I was fascinated by this whole topic. This fellow was big into frogs and amphibians and bits and pieces. And then, of course, yourself, Joe, who your knowledge and empathy towards little fluffy bunnies knows no bounds. So
was that a pun?
We don't do puns, do we?
Okay. Yeah, we do puns all the time. Oh, gosh.
So I put you on the spot with that one.
Yeah, you have completely.
Say no, nurses are rubbish.
No, it's not that. It's that I'm struggling to break just one of many from the mix. And I don't think it would necessarily be fair to do that.
And I think that's lovely, actually, because you've clearly had multiple interactions with multiple nurses over the years that have changed thoughts, changed the way you think about things and just impacted what you were doing at that time as well as possibly in the future.
Yeah, I think actually thinking this through, there is one nurse who I will break out because she's sadly no longer with us. And so she can't get embarrassed by me blowing sunshine at her. And that would be the times and interactions I had with Louise O'Dwyer, who, for those listeners who don't know Lou, you need to look her up. Her story has ended very tragically, but what a force of nature and her knowledge and skill set. And it's interesting, Joe, that you were talking earlier about imposter syndrome. And It was funny. One of the memories I have of Lou was she was going to do CPR in one breakout workshop at the BVNA, which is fabulous. If any nurses are listening and you haven't been to BVNA, get yourself signed up and get down there. Whether you go to the lectures or just hang out in the exhibition hall, it's a meeting of minds, and you will learn from the very moment you arrive there, and you'll make a lot of new friends. So big, recommendation for the BVNA. And I was doing a lecture on, I think, monitoring or capnography, and Lou was doing CPR. And I think Lou was aware that I used to train paramedics in another life and used to do CPR training courses and first aid training courses. And I was feeling, I always get nervous before I go on, which is a good sign, I think. It shows that I'm care. But we met outside waiting for all the students to come in to the relative lectures. And she was saying to me that I should be doing her lecture. And I said, well, you should be doing my lecture. And she said, no, don't be silly. And we both agreed that we were probably both best off doing our own lectures and going in there. But there was that moment of uncertainty that we both had, just questioning what we were doing there and what we were about to deliver. So, if there's one there, I would like to give a big shout out to Louise O'Dwyer.
Absolutely. She was not just a fantastic nurse, but a fantastic human as well.
Absolutely.
And a great loss to all who knew her.
Yeah, absolutely.
I think she was also incredibly good at taking the piss out of me, because she used to spend a lot of time having conversations with each other about why zoo, wildlife and exotic anesthesia was so rubbish, and why we didn't follow the times and we still did the same things over and over again, expecting a different outcome. And did I not know that this was the definition of insanity? So she's a massive loss and a great human being. Yeah. And it was interesting what Mike was saying about how it's hard to pick one out in the area you've been in, and yet Julian, being in practice, had that nurse that was kind of steered you on the right way. And I think sometimes we forget and underestimate how much veterinary nurses train the next generation of vets as regards on their EMS and gathering them in and supporting them. Because I think being a new graduate vet nurse or a vet is very challenging now. I think it's a lot of pressure. And I think vet nurses that are experienced and knowledgeable can be really supportive in that environment. I think that's something we shouldn't underestimate either. And it's not about, again, not them and us. It's just wanting to support each other, whoever. So.
Absolutely. I well remember the nurses that I worked with in my first job, and they were so helpful. Anything from what the diagnosis could be through to how do I know when it's time to take a coffee break? That they'd be I mean standing saying, okay, I've got 4 more people to say, no, go. Now you can have a cup of coffee.
That was them just actually getting you out the way because you were under their feet and they were trying to clean the prep area.
I'm sure, but they were taking care of my mental health.
Absolutely. And I think that's the thing. It's such a caring profession on both sides that we do need to look after each other, because we are terrible. We put our patients before our own welfare. Everyone in vet med, I think, does that to our own detriment. We don't walk away. This isn't an inbox full of emails that we're leaving at 5 o'clock a.m. to ignore. These are little sentient beings that need our help, or colleagues that need our help, and that often to our detriment. We do need to take a step back. And I think that's something, talk about new grads. I think I'm seeing a change come through in the new grads over the last few years. They're respecting their boundaries more. And I think they're protecting themselves more. And I'm pleased to see that come through. Actually, I think it's healthier.
So is that nurses and vets?
Yeah, on both sides. In my experience, I think the new grads aren't as afraid to say no. Now, I think that's a generational shift, not just an academical shift. Academia?
Yeah, academical. Yeah.
Macadamia, which I think that is an educational shift. Societal shift, where in society in general, we've become, on the negative side, slightly more insular and slightly more me. I think that's actually can be quite good for protecting our mental health and protecting our supposed work-life balance. And so coming in as a new grad and being able to say no, when I qualified, no new grad that I knew on any sphere, whether you're a vet or a nurse or a receptionist, would dare to say no.
I think also we need to remove that cultural thing, and it is improving of that if you're good and you're dedicated, you never leave on time, you never have lunch, and you never have coffee
Oh,
break. Because
those badges.
statistically, everybody, there's lots of published data on people crashing airplanes because they're tired. And I know from working in India where I've had 12-hour days, and after 12 hours, I don't even know my own name, let alone how to anesthetize a bird. And I'm definitely not safe at that point. And I think we need to just make sure that people know that they work to their best if they're rested and supportive and well hydrated. And we still have some of that. I think still sometimes it's seen as being a badge of honor, but there isn't any prize at the end for not having any coffee breaks. So, and often clinically and from a kind of mental health support situation, I think often those conversations are often had at coffee breaks. So often that's when you pick up on somebody that is struggling and you get a chance to just interact with them in not a very heavy way. So it's not a big, let's sit down and talk about your mental health. It's more about, are you okay? Can I get a cup of tea? What's going on kind of thing. And I think those conversations are absolutely invaluable, especially for new graduate vets and nurses. I think it can be quite lonely in that first year. So.
It can. And actually, the loneliest I've been in practice is as the practice owner.
Yeah.
Interesting.
It's an odd thing.
You're the boss.
Yeah. Who do you ask advice of? The answer is actually everyone, because they're your colleagues. But it took a while to realize that.
And I've heard that reflected through nurses as well. When they've moved into a head nurse position, all of a sudden lines blur, friendships peter, how to make that transition, how to make that change. And if you're not aware, of how to necessarily conduct yourself, but I think it's different in every clinic. It's difficult to make that transition. So an example for me, when I was in my clinic that I trained in and then I qualified, I was treated very the same as I was as a student nurse, pretty much. As soon as I moved, relatively quickly after qualifying, I was treated completely differently. Now, that's got nothing to do with the colleagues I'd left and come from. It was just, Joe the SVN. And where I walked in with the persona of Joe the RVN, that came with it the standard expectations of you can do this to that level. And that was your baseline that you walked in at. And I think going through any new grads, going through that change, and like you say, it's lonely at the top because it does, it alters the dynamic of the team. And it's certainly something that nurses have said they have struggled with, how to then deal with that. It can be quite difficult.
There's almost, you mentioned badge of honor, Matt, a few moments ago, and I think that's right. And there is a certain badge of honor of, if you're in that higher position, then it's almost admitting failure if you ask for advice or help. You are the omnipotent, the all-knowing, and actually if you need to ask something, well, why are you in that position? Why do you have that job? There needs to be this ongoing teamwork, and there are some people at different, I'm not going to call them eyes, but just different roles within whatever part of the profession, because that is their strength or speciality, or the place they got promoted to because they got too good for the other bit.
Oh, they've just been there so long that they know how everything works, and without them, the whole place would fall apart. And that could sometimes be the cleaner because they know where all their bodies are buried.
Quite literally, yeah.
So I think we'll move on to my next one, Joe, because I think we covered those.
I think so.
Really well. So you touched on it already about there being some kind of feeling that there are blockers and things holding back the veterinary nursing profession. And in my experience, I've not really encountered that too much, but I know others do as well. And I've always had the attitude of try and have a go at things and then see how it pans out. And sometimes that's not necessarily gone quite as well as I'd hoped, but most of the time it's been okay. I mean, I think nurses need to be involved in those conversations and push themselves forward, both clinically and from a kind of knowledge and understanding, if they want to. I mean, there's nothing wrong with being a good, really good first opinion nurse. I mean, those people are essentially underpinning everything. So, but in your experience, I'm going to go to Mike first. What's been your experiences of working with vets and nurses as to what do you think is holding back the vet nurse profession? It feels like we should be progressing more, but what's your kind of feelings on this?
I have no idea, Matt.
Nothing at all.
I have no idea. Well,
Right.
I think to a certain extent there is. I mean, there is an element of a generational thing there, and things I think will get a lot quicker, or nurses will achieve their goals a lot quicker as the old stick in the muds like me move out of the profession, because, well, you're not a vet, therefore, how could you think, why do you think you can do this, that, or the other? The reality being, of course, is that the nurse's skills are probably infinitely better on that role or in doing that particular skill than the person that's bad-mouthing them. And the simple act of having a qualification is not necessarily a qualification for that role or for practicing those skills.
Mm.
So I think things will speed up, and certainly with people like yourselves pushing harder all the time, breaking new boundaries and raising that ceiling. There are a lot of vets. You've both got a lot of good skills in some very special areas that a lot of vets don't even cover. And by showing your skills in these areas and developing them from the niche to other areas, I think that will improve things greatly for vet nurses. But
it can only be for the greater good. It can only be that if we work together well and we share each other's knowledge and information happily together and support each other, it can only make for a more harmonious and enjoyable day in a veterinary facility, wherever it be. And I mean, and that's really interesting. So when you said you didn't know anything about it, you actually did. Just saying. Yeah.
You're just being coy.
It's just,
I always thought you had.
That's just in my opinion.
No, I think it's good. And I always thought you had an opinion on everything. So I was surprised when you said you didn't. I mean, that's quite shocking.
Feel the burn.
So, Dr. Professor Hoad, what's your thoughts? What do you think what could we do as vet nurses to progress more? Do you think we're doing okay, or what do you think?
I was going to agree with him. I was going to agree with Mike, but I had something else, because I always do. But I think, to a great extent, what Mike said was true and is still true. And it's going to be a generational change. The older vets who don't see the potential of nurses from a clinical point of view are going to either get retrained or die off or retire. Same thing. But there's a new problem creeping in, which you hit upon earlier, I think, Joe, about, actually both of you did, you mentioned mini vets and cheaper treatments. And I think there's a danger that, I'm going to say corporates, because it's mainly the corporates I hear about pushing for it, is for nurses to do more of what was traditionally a veterinary role, purely because the nurses aren't paid as much. And so it's not that they're going to charge the clients less, it's because they are a cheaper resource to have. And that, to my mind, is a huge danger. We need to achieve some sort of parity with that. And however we do it, however we go about it, I don't know, because they're always going to come back to we look at a multiplication of your earnings, of your takings to create a salary. And I think we need to get away from that and think, let's almost live like a sort of a communist quango. We need to know that actually, without nurses, vets can't do stuff. Without vets, nurses can't do stuff. So it is a true team approach. The money comes into it hugely because that drives practice, particularly so these days. And so there has to be a recognition that nurses that are doing something that traditionally was a veterinary thing should earn the same thing.
Yeah.
I think
a-
that's a really interesting thing. There's a lot of narrative, as we all know, with the acronym that we've all started to dread, the CMA, as to what's going to happen next and what's going to be said next. And just this week, I've read some of the proposed remedies, and there's a couple of sticky bits that make my heart race and get put 50p in my meter, and I go for a few hours. And one of those was a recommendation that nurses can do vet procedures for a cheaper price. And I think that's a very dangerous place to go for both professions. I don't, not just the nursing. I think it devalues everybody.
Absolutely. Joe, I read that, and my wife, my poor long-suffering wife, told me to shut up, because for half an hour I just said, "How dare they? How fucking dare they?
You got my 50p.
How dare they?" But yeah, absolutely. Why have we charged traditionally in most practices less for a nail clip done by a nurse?
Yeah. And I think it's something that, interestingly, when you talk about KPIs and ROI, returns on investments, and these kind of very corporate-y industry stuff, again, it's another thing, another one of my soapboxes. We've gone from professions to industry, but we don't have the backup of industry support. We haven't had that training and that onboarding to turn us into an industry. And I think when you look at how owners perceive value in the veterinary world, it's really quite interesting, because it's the fluffy stuff. So what makes a good vet? They're kind. They know my animal's name. They remember this. It's not actually they fixed it. It's not that they've made my arthritic dog feel better for the last 10 years. It is the fluffy stuff, and that's immeasurable. And I think this is where not just corporates, but any of the companies that are veterinary clinics that are running heavily on the money side and making people literally looking at how much you bring in, what are you an income generator, and what you're doing for that practice. I think that's a very short-sighted, and again, in my opinion, lack of industry training, that you can't be a fee generator without fluffy stuff, because you can be the best surgeon in the world, but if your bedside manner's shit, then no one's going to come and see you.
Yeah. And I've seen the converse. I've seen vets who are absolutely crap, but really charmed clients.
Yeah.
And I'm so sorry. I'm so sorry for you. I really am. It always was a difficult op, and I'm afraid, Fifi just didn't pull through. Cat castrates can be like that.
I often slip and catch the aorta.
Yeah, you're better at them now, though, Julian.
We've lost some of that art of veterinary surgery. I think that's the bit of it. I mean, for me, I feel like that's what we've forgotten about. My first practice had two partners when I first started, Johnson and Daniels. And Mr. Johnson used to tell me that owners will not remember how you treated and saved their animals, but they'll always remember if you were kind to them, and also how you killed their animal. So they'll always remember that you've been empathetic, supportive, and not feeling rushed, and taking the time to talk. And he had a million phrases for a million things. And I learned huge amounts from him, including going to owners' houses and him saying, well, they'll offer us a cup of tea and we'll have a cup of tea. We won't drink it because we haven't got time. We've got too many visits, but we'll pour it into a flower pot, tip it down the drain when they're not watching. But we'll take one because it's the right thing to do, and they will feel that's the right thing, And I think some of that, and we shouldn't be calling these things soft skills. That's a bit irritating. I feel like these are just skills. I mean, we need to have these things.
Soft skills is worthless.
Yeah, and I think it's really important. And just another facet to that is the dreaded impact word. So in conservation veterinary medicine now, that I get involved in the conservation side of it a fair bit now, everybody wants to measure impact, because investors want to know, donors want to know what the impact is, and often you just can't measure it. I mean, that giving that like you seeing work experience when you were a child and having the opportunity to see that person work, that's really impact, and that's gone on to change your direction and push you into what you do now, and that's impact. So it's not necessarily those things you can measure, and so for me, it definitely isn't how much money you take in a day. I think that's got nothing to do with it. Because in my experience, personally, I think owners are not that bothered about what you charge them, as long as they see it as being value for money. So you can't have your cake and eat it. You can't have somebody in and out of your consulting room for 5 minutes and then charge them the earth. It's a real bad metric, I think. But yeah, that's really interesting.
I completely agree. completely agree with you. And what sort of message are we giving to clients that, well, we need to suture this wound. That'll be £800. Mind you, if we get a vet nurse to do it, it's 500. So what's that saying? Well, they're not as good.
Yeah.
Especially as so many people don't even know what a vet nurse is. I mean, there's still a lot of owners who think vets are octopus or octopi, and they just grow these extra arms and they deal with the wobbly bits and they open their own kits and they deal with the anesthesia. And, they're just this absolute wonder man in these pants and cape, as I'm sure you've done many a time, Julian, in the operating theatre.
I know. It's pants inside the trousers, isn't it?
Especially when you go
always forget.
shopping, it's frowned upon. Remember, you're
I know. I can't. So many supermarkets I can't go to these.
But I think that some of the driving stuff, like when you owned your own practice, I'm sure you didn't shy away from telling clients that you were going to call a nurse out for a procedure or something like that. When I was training, whenever that was, early 90s, Bill Starr, who was one of the partners at that time, he would actively call the clients and say, you know what, your dog needs a C-section now. I'm going to call out a vet nurse. It's going to cost you. And I remember it was 20 quid at the time. And we got that £20. So that came straight to us being called out. And he would actively tell the clients that he couldn't do this without a vet nurse. And they used to do the same for cow seasons as well, that we would get an extra bit of money. And that exposure to the clients, I think, is really important, be them farmers or cat and dog owners. I think it's really important that they understand that our time is valuable and we are a key part of the jigsaw that makes the animal have a positive outcome.
Absolutely. It cannot be done without you. It needs the team. There's a pet, there's the owner, there's the vet and the nurse. And there's the receptionist and cleaning staff and everything like that. But actually, they're
clinically, we've got our clinical
clinically, it is that triad.
And it's interesting, isn't it? Because I've seen what I call the good, the bad, and the ugly of vet med, and I've had some shocking practices and some shocking colleagues, and I have been told that my job is to stop the vet being bitten. That's my job, is to stop the vet from if I'm restraining, well, you do not let go. You take the bite, not the vet. Their hands are more important. There's lots.
I thought when you were describing the good, bad, and the ugly, you were describing the panel members. Then I was thinking, we haven't finished yet. Let's not go.
Who's who?
Well,
don't want to.
That's fairly obvious, isn't it?
People think Mike and I are twins, so we must both be ugly. Or
I think it's we've had a lot of love on this episode, which is fantastic. But I think it is important to also highlight there is a darker side, and not everybody has a fabulous unicorn practice, and and there is support out there, and it's important to kind of reach out, talk to others in different scenarios, no matter what position you are in, because there's some horrible places and there's some horrible people doing some horrible things, but luckily they are a minority. But certainly my experience of early days being a nurse was very much behind the scenes, seen and not heard. The vet to the client is very much me. I will do this, I will do that, and then the animal gets represented. And from my extensive chats with lots of veterinary nurses of all different ages, I think that's wasn't an uncommon thing, and still unfortunately happens to some extent these days. I think we've come an extraordinarily long way, and associations like BVNA, BSAVA and BVA have all been very kind of pro nursing and fighting for this. But I think it's good to think we've still got a long way to go. We've still got some big key things to tick off that list.
And something that somebody said to me recently, which I thought was really important, is to remember veterinary nurses are not trees. They can move, they can get up and move. So if they're not in a practice that they're not happy with, then look look for different opportunities. And it's important that your practice is a good fit for you. I was very lucky with my first one. I really liked it and I learned loads, and it was a very supportive practice. I think I had a head nurse that was terrifying to start with, who had very clear phrases that still come up in my head now. She used to say there's only two speeds, the quick and the dead, because she used to think I was incredibly slow. And I can remember her saying to me that she'd never met a good male veterinary nurse, and that was nice. So maybe she wasn't the most supportive, but what she did teach me was she taught me a lot about professionalism, about standards, about client care, patient care. Yeah, I learned a huge amount from her. And I think that, it's definitely improving. We just need to keep pushing. I think it's important that all vet nurses engage with the Royal College of Veterinary Surgeons, with their associations,
Yes.
get involved, be the catalyst of the profession that we want for the future. I mean, I feel I'm coming to the end of my professional career now. Maybe
Oh,
then
here we
just-
go. Here we
Yeah,
go.
yeah, the
Down
podcast
to your
goes.
last 20 years. Yeah.
Yeah, exactly. Yeah, so- but I think it's important that we try and make it as good as we can for the next generation. And for vets and for nurses. I mean, it's across the piece. So
And we can learn from these negative times that we have as well. They're shocking when we're in them, and it's the worst place in the world, and you just hate life. However, they do shape you. I don't like the word resilience, because I've had to be resilient so much in my life for my own health battles, let alone career battles. Like, I tend to twitch when people go, "Oh, you're so resilient. You cope so well." I have no option. I have to cope or die. And I think they do shape us, and we do learn. And when you get on the other side and you find a practice that's a better fit for you, or a job or a role, whether that's in clinic, out of clinic, then I think, that's really rewarding. And you come out the other side, and being able to then notice the darker sides and the not so nice sides usually means you're a bit more open to not doing it. And having that, you've experienced it, therefore you're a bit mindful. If you see it somewhere else, you might nip it in the bud, because you're a few years on and you've got a little bit more about you, and your elbows certainly my elbows have got pointier as I've got older, and I've got no worries now with saying what I think. So sorry, BSAVA, but you took that on.
Absolutely. And that's why we took you on.
And I think also making sure that we make it clear to all vets and nurses that it's okay to not be okay. I mean, I think that's more than nurses, but increasingly we see it in nurses now, is that they're not prepared to show weakness. They're not prepared to say, actually, do you know what? That was not good. That didn't go well. I wasn't happy with that. That's made me feel rubbish about things. That changes as you go through your career. I think your perception of what is good and bad, I think, changes all the time. But as you go through your career, but I think we need to be more honest than that. When I teach students, I'm always very honest with them and tell them that, as Joe has said, we've all gone through mental health, physical challenges through going for our career, but it doesn't define you. It's just part of that journey, and you have to move on, and it makes you more empathetic and makes you more understanding for other people. And I think that's incredibly valuable. Crazy people look up to me and they say, "Oh, you've had this amazing career," and all that kind of stuff. I'm always very clear to say, and you guys kind of covered this at the beginning, that it's very hard to see positives a lot of the time. You spend a lot of time just thinking, well, actually, I could have done that a bit better, and maybe that would have been right, and maybe I should have, looked after my teeth better and not got so fat, those kind of things. But I think increasingly you have to be open and support each other, because I think otherwise, as we said, it could be really lonely. And I'm really incredibly grateful for you guys letting us hijack your amazing Veterinary Ramblings. I think it's been a hoot. So I'm going to hand over to Joe for the last question.
Final question. Dun, dun, dun. Okay, so we
I've
thought
already answered it. It's wholemeal. No, rye bread. Rye bread.
Soda bread. We want a
No, I
nice...
want focaccia. I want
No, I
focaccia. I
want
like
a
focaccia.
Peshwari naan, please. Nice Peshwari naan.
Oh, I wouldn't mind that. Yeah, Peshwar. Yeah, I made some Peshwari naan the other day.
I bet you did.
Oh,
Can you make
bet you
some
did.
palak paneer to go with it as well? That'd be delicious. So
Yeah, I can
sort
do
out
that.
for us.
I can do that. You tried to have my buttered chicken, didn't you?
I did. Yeah, that's not a euphemism. Yes, I have had your buttered chicken. So, and it was
You have
very,
yet to
very-
experience
There we go.
Julian's
Very memorable, so-
cuisine.
I mean, Julian is a hell of a cook. In fact, he recently came second in a.
I don't think anybody's heard about this.
a
I
competition.
don't think it's been
He came
mentioned.
second in a competition, and the winner of the competition was none other than the winner of MasterChef 2024. And of all of the people, Julian came second.
Yeah, yeah. All
All of them.
Yeah.
of them.
Absolutely,
No
he was-
imposter syndrome there. Proud of it.
No, that's
Yeah.
it. He was the first of the losers. It was fantastic.
Absolutely.
Yeah, there we go. Right.
And the last of the losers too.
And the middle.
In the middle. I kind of lost in every position there, didn't I, really?
Oh dear, we better not mention positions. Moving swiftly on.
That's getting a bit bad,
Yeah.
isn't it?
So yes, a dark rye bread, which I could put herrings and.
Ooh.
You don't want to have
Scandinavian.
herrings out when you're near them polar bears. I mean, taking your life in your hands there. They love a herring.
yeah.
Yeah, they don't
struggle
eat
with
very-
them ring pulls on the top of the tins. That's the only thing they struggle with. But otherwise, they love
Yeah,
them.
so the question is, what discounts do veterinary nurses get for your amazing Arctic tours or
Yes.
Antarctic tours? What do we need to quote? Veterinary Ramblings 2025 or?
Yeah, if only.
Yeah. So we thought it'd be quite nice to end on a bit on a funny if we could.
Cool.
And so, do you have any funny memories, any funny moments that involve either Matt or myself or the pair of us over the years that you can think of that spring to mind?
Funny,
Or
man.
are we just the dullest people on the planet?
No, you guys have been a lot of
You
fun.
kick us
I
away
mean,
from the table.
we've shared a number of things on our journeys, and again, it would be difficult to single any one out. I mean, it's my memory of Matt, of course, is my first meeting with Matt, which is probably 30 odd years ago, in the practice in Watford, and we were talking about he wanted to find out about this new invention called the pulse oximeter, and I was rather intrigued that I'd found out that he was particularly interested in frogs and reptiles, but no.
And I assume you're not putting the probe on the frog's penis.
No.
Yeah, it's tricky. They don't really have one, so
Yeah.
not of their own anyway. But
Yeah. So
Use somebody else's. And Julian, does anything kind of spring to mind from you guys, or just the general hilarity that ensues when we're around?
Well, do you know, it's both. There's one thing I'll get to that in a second, because I never give a short answer. But it's the feeling of warmth when I'm around both of you,
yeah.
and the general narrative, and the feeling that actually, yes, the profession's in safe hands.
Yeah.
Very
But there is a
kind, thank you.
particular standout moment in Greece last year, Matt, when I was lucky, there's the word lucky again, I was lucky enough to be in the presence of Matt in Greece. And we...
just make it clear, Greece the country, yeah?
Yeah, we
Just
were
make-
covered in Greece. We were covered in...
It's a cold water swimming.
Oh, so Greece the country.
Yeah.
And we went to the zoo in Athens. And we were, well, Matt had to check some of his patients. And I sort of wandered along thinking, great, fantastic. I get to see some seals and some dolphins. And this rather gorgeous girl was training the seal to be checked, wasn't it? It had a lump on its side.
Yeah.
And so she said, while I'm here, can I look at this, the lump on this seal's skin? And so part of me, the bigger part of me, I like to think, was professional, thinking, yes, of course, I will absolutely check this lump to see whether it's benign or malignant. The bigger part of me was, I'm touching a seal. I'm touching a seal. And so this girl had her hand placed on the seal's nose, which was her way of stopping it from eating someone who might want to touch its skin, for example. And so, having carefully checked the lump and made sure that it was, in all likelihood, a benign mass, I then thought, well, I'm going to pat its nose. I was just about to do that, and Matt said, yeah, it'll bite your fingers off, mate. Right, there we go. Yes.
Sound advice, yeah? Sound advice.
Sound
You got
advice
quite big
and
teeth, I
a
mean.
burst bubble from Matt.
Straight
Well,
back down to earth. You're not the zoo
Yeah.
vet you thought you were.
Definitely
Yeah.
not.
Bitey little buggers wrapped in blubber.
Yeah. Who are we
Yeah, but
talking
that's
about now?
enough
Is that
for
me
me.
again? Or...
That's my strap line.
Yeah, seals.
And Mike then has described the three of us quite aptly.
No,
Yeah,
amazing.
excellent.
So thank you very much, Sam. We really appreciate your time, and thanks for allowing us to take over Veterinary Ramblings for Veterinary Nursing Awareness Month. It's been brilliant, and you guys are great. And thanks to being incredibly supportive for veterinary nursing and Jo and us personally. So I'm going to hand over to one of you guys to do the handoff properly.
Yeah, so I think actually I'm going to butt in. I'm going to say no, I'm not letting them do it. I'm going to go ahead and I'm going to do the sign off.
Ah.
So carrying on, thank you very much to our amazing panelists, Mike and Julian. And for anyone that has enjoyed today's episode, then please do like and share, follow. But also, who do you want to see interviewed next? Who are these top people? If there are any key nurses that you're keen to hear from, or someone with an interest, or is it yourself? Put yourself forward, be brave, and come and join the panel and have some fun.
Great.
Fantastic.
Thank you.
May
Thanks.
your-
And apparently I've got to say, may your dog go with you. There we go.
Cheers.
May
Cheers.
your
Oh,
dog
hang
go
on.
with you.
May your dog go with you.
May your dog go with you.
Amazing.